will be starting in a few minutes, waiting for participants to join. Starting in a few minutes.
Joseph, can we start? Okay. Okay, good morning, good afternoon, good evening, bonjour, ribet, ni hao, salam alaikum, buenos dias. I'm Dr. Sylvie Briand, the Director of the Global Infectious Hazard Preparedness Department at WHO in the WHO Emergency Program. And it's my great pleasure and honor to welcome you today to the second roundtable discussion, exploring the future of COVID-19 pandemic and other infectious threats. We decided to have two roundtables at different times in day in order to have panelists from different parts of the world. And I would like to first warmly thank the excellent set of panelists who are with us today. I know that everyone has extremely busy schedules, and we are very grateful that you are making the time to share your expertise and experience with us to improve preparedness for future pandemics. Indeed, this infectious hazard foresight initiative is really about shifting from reactive to a proactive approach to address infectious threats. It is true that during or after epidemics and pandemic events, we see flourishing many lessons learned exercise. And we tend to fix the problem encountered during the last pandemic, hoping that we will be better prepared for the next one solely by solving problems already faced. Unfortunately, the next pandemic may be very different. We may be caught by surprise if we do not imagine the various plausible future ahead of us. Together, we are going to imagine the future so that we can influence our destiny. The scenario that will be discussed today are based on a robust and evidence-based analysis of trends, and it's different from forecasting or epidemiologic modeling. It aims at bringing together a wide range of perspectives to imagine plausible future, debate around a set of meaningful scenarios, and identify proactively threats, opportunities, choices, and innovative solutions so that we can collectively strengthen pandemic and epidemic preparedness. Following a series of engagement and webinars with internal and external experts from various fields, WHO and global partners have developed 4 scenarios, each of them illustrating a plausible future world. And today, we have invited 7 panelists from various backgrounds, sectors, and perspectives to help us grasp with the complexity of our current world and the multifaceted crisis we are in. We are pleased also to have many participants online to contribute to this collaborative effort to imagine the future and enhance cross-sectoral dialogue and cooperation for better preparedness and response. My former boss was often telling me, if you are not at the table, you are on the menu. And today we are all at the table contributing to a better future. So I'm looking forward to our fruitful discussion. Thank you again for joining us for this journey. And I would like now to hand over to Joseph Hargrave from Arup, who will be moderating the session. Over to you, Joseph.
Thank you very much, Sylvie, and thank you in particular again to all of our panelists, and of course, you, the participants listening into the webinar and joining the conversation. We hope that you will all be on the table today with us and not on the menu, and there'll be various opportunities for you also to engage in the wider conversation. My name is Joseph Hargrave. I am the Global Foresight Leader at Arup, and I'm absolutely delighted to be your moderator for the session today. We have an incredibly diverse panel, which will be introduced in much more detail later on. But the idea is really to bring a wide range of different views and perspectives to the table and to enable a cross-sector dialogue on the future of the pandemic and other infectious threats. We're going to explore the future of the COVID-19 pandemic today and the future of other infectious threats with a 3 to 5 year horizon. So we're trying to look a little bit into the midterm future. As Sylvia has already said, we have developed 4 plausible scenarios. They are all plausible, they are all possible, and they are not predictions. They are an invitation for strategic dialogue. So we're not trying to predict the future, but we're trying to map out plausible pathways and then discussing what these pathways might mean in terms of our collective response and our individual and collective implications. We're keen to hear your views. There will be various opportunities for you to contribute. And it's really all about cross-sector dialogue and engagement. We're going to really aim to find ways to manage the current pandemic better, be better prepared for future threats and risks, and also utilize the scenarios to perhaps have a different type of dialogue around COVID-19 and the future of the pandemic, and really focusing on both solutions and risks on how we can move forward. The first part of the agenda today is for me to give you a bit of an overview of what we're trying to achieve, the process to date, and also the agenda for today's session. So I will do this now before we head into the conversation. So this is the agenda for the session today. We've already heard the welcome from Sylvie. In a minute, I'm going to talk to you quickly about the project methodology and also the progress we have made to date. Then I will introduce the 4 plausible scenarios that we have developed, and you will see a short video outlining some of the key assumptions and the stories and narratives behind the scenarios. And then we'll go into the first part of the roundtable conversation. And this will really be focused on reflections on the scenarios. So how do the different panelists feel about the scenarios? What do they take away from them? And what questions might be related to their specific area of expertise and background? After we've reflected, we're going to slightly switch the focus of the conversation and develop strategies for collaborative global action, talk about recommendations, the path forward, and what we can do better. And then finally, we will have some final remarks from Dr. Mike Ryan, and then we will close the session and conclude. And in between, there's various opportunities for you to engage and for you to participate. First of all, we would like to encourage you to ask questions through the Zoom Q&A function. So you can use that to submit questions. We will not be able to necessarily answer all of the questions, but there's an opportunity for you there to contribute and also to ask questions that we can then feed to the panelists. The second one is to share your views. We've prepared a number of live Zoom polls, 2 of them. So at various stages, a little window will pop up on your screen and you'll be asked to answer some questions. And finally, you can join the conversation online. You can use Twitter or Instagram or LinkedIn using the hashtags COVID scenarios, WHO foresight, and pandemic preparedness. So various ways for you to interact and be part of the table and not the menu, as Sylvie said earlier. So the first thing I want to do is just talk quickly about the meaning of foresight, the meaning of futures thinking, and why we developed a set of scenarios. Foresight describes a set of approaches and tools that are designed to help identify trends and emerging issues, negotiate uncertainties, articulate scenarios, develop a vision of a desired future, identify opportunities for innovation, or design robust policies and strategies. And all of these are relevant in the context of the pandemic. So really, foresight is about structured thinking about the future. And these roundtables are part of that structured thinking and that meaningful dialogue about change, which we want to have. Why are we doing this? We are doing this because we are living in a VUCA world. The world is increasingly characterized by volatility, uncertainty, complexity, and ambiguity. And foresight is one of the methods that we can use to deal with this, to break down uncertainty, to manage complexity, and to reduce ambiguity in our choices and the way forward. It's also about exploring alternative plausible futures and understanding current systems better. If we think about the future, we can go from now into the future space, and the space of the possible will always increase as we move forward. And there might be scenarios within that are most probable, that are preferable, or they're a little bit more undesirable. The other thing that we understand is that when we look at the future, we always have to start with an analysis of the system that we are investigating, breaking down the various components and really trying to understand how a system works before we envision how we might move forward across these different plausible pathways. And we do this because it's all about impacting positive probabilities. And there's a nice quote from Elon Musk that he mentioned at Conversation at TED 2017. And he said, "I look at the future from a standpoint of probabilities. It's like a branching stream of probabilities," which takes us back to this diagram here on the left and the branching and widening option space. And there are actions that we can take that affect those probabilities or that accelerate one thing or slow down another. So by having a conversation about the various pathways that we can take into the future and perhaps the more desirable future that we want to head towards, we can have conversations and we can take actions that impact the probabilities that we will achieve a more positive future. So a little bit on the project method and progress to date. We started this investigation together with WHO back in June. The first step was to identify trends shaping the future of COVID-19 and other infectious threats, getting a big overview of the mega trends and sector trends that are driving the shape of the pandemic from a social, technological, economic, political, environmental perspective. The second part is to map the components of the system, identifying so-called key factors and developing projections. And I will talk a little bit more about that in a second. The third is to use that information to outline a series of consistent and plausible scenarios for further refinement. We then engaged a broad range of global experts to review and validate the scenarios in a series of workshops that covered all aspects of the world. We developed a set of indicators, crafted scenario narratives, and produced some visuals, and some of this work is what we're sharing with you today. Now we're having a discussion on implications and recommendations in a series of public roundtables. And after today, we will complete the technical and scenarios report, taking into account what we're hearing today and also wider feedback. And then finally, we will start to communicate the outcomes and engage a broad range of stakeholders in this conversation about change and the future of the pandemic. Why scenarios? Well, scenarios are hypothetical yet plausible illustrations of the future. And both words are important here, hypothetical and plausible. And as I said previously, they are neither predictions nor forecasts, but plausible chains of cause and effect. They are an invitation to strategic dialogue, not prediction, but an invitation to strategic dialogue. So scenarios can actually help leaders and decision makers frame their strategic thinking and test and refine strategy and policy options. So this is again what we're trying to do here, to hopefully come up with some recommendations and some conversations that can help us manage the current pandemic better and also be better prepared for future pandemics and other infectious threats. So here's an overview of the key factors that we looked at for our scenario development with a 3 to 5 year horizon. We split it essentially into 3 categories: pathogen and host characteristics, public health and social measures, and then a wide range of contextual factors. So for example, in pathogen and host characteristics, we have new pandemic risk or the virus transmissibility as key factors. Within public health, we have public health measures, of course, but also treatment and prevention options and communication patterns. And within contextual factors, we have things such as the role of non-state actors, conflict and civil unrest, healthcare innovation, but also, of course, human behavior, values, and opinions. And overall, this really paints a complex ecosystem of change driving the future of the pandemic. The next step was then to develop projections for each of these individual key factors. So as an example, the projections for vaccine efficacy and access are high efficacy and widespread access, high efficacy and region or country-specific access, mixed efficacy and widespread access, and mixed efficacy and region or country-specific access, and then finally, limited or reduced efficacy. So they are, if you like, mini scenarios within each of these key factors. And we then build scenarios by combining consistent projections from each of the key factors to develop our baseline assumptions. And as you can see here, the ones highlighted in blue are the ones we used for one of our scenarios. Now, this method is called the so-called morphological approach to scenario development. There are many different methods to build scenarios. This is one of the most transparent, coherent, and rigorous. You will be able to access the full technical report of our work in the coming weeks, and this will be shared with you, and this explains the methodology and the process behind it in much more detail. We're not going to dwell on that too much today. So next, we're going to start to introduce the actual scenarios. And I'll ask our WHO technical team to start sharing a short movie that will introduce you to the scenarios and some of the key assumptions. We're going to start to introduce the actual scenarios, and I'll ask our WHO technical team to start sharing a short movie that will introduce you to the scenarios and some of the key assumptions.
How will vaccine distribution, trust in science, and economic priorities impact the pandemic and our preparedness for future infectious threats? Will everyone benefit from technological and scientific progress and healthcare innovations while responding to a global climate crisis? Will we take the collective action needed as a global community? Will humanity work together as one? Through collaboration, focus, determination, community empowerment, and hard work, humanity managed to get on top of the pandemic. Annual booster shots, combined with vaccinations for the flu, ensure that the mortality rate from COVID-19 is very small, and no higher than the mortality rate of other pathogens. In 2024, the WHO helped prevent the outbreak of another novel coronavirus in Eastern Europe, quickly containing the outbreak and preventing international spread. In 2025, the second generation of vaccines managed to completely contain virus transmission. Other vaccines delivered in pill form further enabled enhanced distribution, reach, and affordability. False information about the pandemic is effectively countered, and nations and healthcare organizations operate based on coordinated common truth campaigns with consistent scientific messaging and guidance. None of the progress that was made following the COVID-19 outbreak would have been possible without a spirit of science-driven decision-making and strategic collaboration between nations worldwide. The virus remains, and it's evolving. Humanity has gradually learned to live with the virus, yet still clings to pre-pandemic behaviours and approaches. New variants appear frequently, which the first generation of vaccines are ineffective against. Through constant testing and continually updated vaccines, the WHO managed to prevent several additional pandemic outbreaks, but affordability and reliability of rapid tests are still an issue. Trust in governments and public institutions varies across the world. Some attribute the protracted nature of the pandemic solely to the inability of their leaders to make rapid, informed, and inclusive decisions. The boundaries between digital and physical environments are blurred, with hybrid ways of working, meeting, and learning now the norm. Nations are still heavily reliant on fossil fuels, and deforestation prevention has not met the desired targets. The COVID-19 pandemic is not over, and the virus has evolved to become even more infectious. New, more threatening variants emerge frequently, leaving vaccine manufacturers struggling to keep up. Long COVID-19 symptoms are the norm for almost everyone who gets infected, putting a significant strain on economies, productivity, and healthcare systems. Each nation focuses their efforts on different fronts, Some focus on measures to inform and educate the public in efforts to reduce transmission, while others focus on reopening their economy, barely able to support their overburdened health systems. Multiple platforms and groups generate and spread false information about COVID-19, contributing to an increasing lack of trust between citizens and their governments. Some politicians deliberately argue against the scientific consensus to appeal to their followers. A large part of the global population is still unvaccinated. Vaccine nationalism and vaccine distribution bias against key minority groups are on the rise. The world is suffering from the lack of a unified front to battle the worsening climate emergency. The WHO and UN are no longer a forum of transparent discussion and collaboration. In addition to a worsening COVID-19 pandemic, a Zika-like vector-borne virus carried by mosquitoes spreads throughout the world. Nations struggle to establish public health measures that do not contradict each other. There is widespread confusion and conflicting priorities about what to do to protect from COVID-19 and the new virus. Given the inability of governments to inform, people turn to those who would provide reassurance during the double pandemic. Trust in society and science has never been lower. Due to intense border restrictions, the aviation and tourism industries have collapsed. People abandon towns in areas with high mosquito density and move to other areas, causing a strain on infrastructure. Healthcare systems, affected by rising cases, backlogs and staff shortages, find it nearly impossible to cope. Those with higher incomes can afford better care at better staffed facilities. Overall environmental degradation is accelerating. Species go extinct, and those who survive will be the carriers for the next pandemic. So, what will the next 5 years look like? Will we be able to build consensus as a global community? Can we take the collective action needed to mitigate the ongoing risks of COVID-19? Will we be prepared for future infectious threats? What world would you like to live in?
Okay, those are the 4 scenarios. As a reminder, we do believe that they are all plausible. There are different plausible pathways into the future. Some of them are clearly more desirable than others. So as a reminder, we have scenario 1, a little happiness. Scenario 2, I love you, I hate you. Scenario 3, heartbreak hotel. And scenario 4, here comes trouble. And as a reminder, I'm just going to go through some of the key assumptions for these scenarios again, so that you as an audience are conscious of the various assumptions that we are making throughout. So scenario 1, a little happiness. The virus is less potent and there's widespread natural or acquired immunity. New affordable COVID-19 treatment and prevention options are offered at a global scale and also affordable scale. Low mortality rate and low risk of long COVID-19 symptoms persist. New pandemics do appear, but they do not become a global health crisis. Economies recover after a short pause. Nations also sign an infodemic treaty to combat mis and disinformation. And there's also wider positive benefits, such as access to healthcare for all being improved. There's broad societal benefits to improve global coordination and preparedness. Technological and scientific progress and healthcare innovation are happening at a rapid pace. Widespread climate change mitigation adaptation is happening. COP26 has been a success, and the world is working as one, and humanity gets on top. So clearly the best case scenario. Scenario 2, I love you, I hate you. There's a protracted pandemic with continuous virus evolution. Immunity levels vary depending on age group and health status. Vaccines are playing catch up, but efficacy levels are high and access is widespread. Stricter elimination and mitigation measures are implemented based on season, case numbers, or regional strategies. Some healthcare systems adapt well to surges of the virus, but others struggle, creating a backlog of treatment. Trust in governments and public institutions vary significantly across different parts of the world. Healthcare innovation is happening at a rapid pace, but diffusion of benefits is really limited to certain nations and regions and income groups. Economies worldwide experience a midterm pause, with some economies recovering only partially. climate change mitigation remains sluggish, and extreme weather events become more frequent, and humanity just about keeps up. So this is in many ways close to where we are at the moment, or so-called business as usual scenario. Scenario 3, Heartbreak Hotel. The virus becomes even more infectious. Human transmissivity levels record new highs. New variants emerge and vaccines lose efficacy. COVID-19 now also causes a wider symptoms range, and wider age brackets are impacted, such as children. And long COVID rates are unfortunately increasing. Diagnostics, surveillance, and tracking vary significantly in quality and reach across nations. Healthcare systems globally struggle to keep up with the surge in infections. The infodemic is once again thriving and hard to control. Economies are suffering the consequences of long-term pauses. Recessions and economic hardship are increasing. The fight against climate change is not yielding the expected results, and the pressure to adapt increases. Regional and cross-country cooperation is inconsistent, with only selective support and cooperation, and we experience collective failure. Humanity plays catch up again. And finally, here comes trouble. Another global pandemic emerges in addition to a worsening COVID-19 pandemic. A new Zika strain renders the COVID-19 public health response in tropical regions ineffective. Some vaccines are working while others are not. Access depends heavily on income and citizenship status. Diagnostics, surveillance, and tracking systems struggle to cope with two pandemics happening at the same time. The double pandemic threat has left many healthcare systems in peril, with low resilience and a growing backlog of treatment. Efforts to tackle health inequality and intersectional inequality are severely hindered. Economies experience a protracted global pause, leading to eventual economic collapse for some. Tackling the climate emergency is no longer at the top of most nations' agendas. The wider situation leads to a breakdown of global collaboration, coupled with severe regional conflict and unrest, and humanity struggles to manage. 4 plausible scenarios, all possible, some more desirable than others. So, to kick us off with the audience participation engagement, we're going to launch in a second a Zoom poll to ask you, which scenario do you think is most plausible? Is it scenario 1, a little happiness? Scenario 2, I love you, I hate you. Scenario 3, heartbreak hotel. And scenario 4, here comes trouble. And we're going to look at the results after the first round of conversation. So the question, the poll has just popped up. Please feel free to answer, and then we will get back to the conversation in a second. All right, while the audience answers, it's time for me to introduce our amazing and fantastic panel. A really diverse and super interesting group of people, and I'm very excited personally to be speaking to all of you today. Let me just go through a few quick introductions of who we have on the panel today. In alphabetical order, first of all, we have Professor Akin Abayomi, and he is the Honorable Commissioner for Health of Lagos State. Akin specializes in internal medicine, hematology, environmental health, biosecurity, and biobanking. He currently serves as Lagos State Commissioner for Health and has led the COVID-19 response for Lagos since March 2020. Then we have Dr. Bruce Gellin, Chief of Global Public Health Strategy at the Rockefeller Foundation. Bruce is one of the world's premier vaccine and infectious disease experts and brings extensive experience and expertise in global public health. He is a key member of the team building a pandemic prevention institute that aims to avert future pandemics by identifying and responding to the earliest alerts of disease outbreak and stopping it in the first 100 days. Then we have His Grace, Dr. Stephen Samuel Kazimba Mugalu, Archbishop of the Province of the Church of Uganda and Chairperson of the Interreligious Council of Uganda, Council of Presidents. His Grace was elected the 9th Archbishop of the Church of Uganda in August 2019 and was enthroned as Archbishop on the 1st of March 2020. At the time of his election, he had served as the Chairman of the Provincial Board of Households and Community Transformation, as well as the Chair of the Board of Trustees for Ndeji University, Chair of the Committee for HIV and Public Health for the Interreligious Council of Uganda, and Chair of the Words of Hope Uganda Radio Ministry. Then we have Mr. Ricardo Mendes Speck, Director of the United Nations Office for Disaster Risk Reduction. Ricardo has over 20 years of experience in disaster risk reduction, leading UN disaster and coordination missions in America and Europe. He currently manages 35 countries and 15 territories as Chief of Regional Office for the Americas of the UNDRR. Then we have Alison Neal, Vice President, Public Policy of Henry Schein. Alison has worked in global health, corporate social responsibility, and human rights for more than 2 decades. As Vice President of Public Policy, Alison leads Henry Schein's public policy and public health engagement by partnering with governmental, intergovernmental, and non-governmental organizations and industry groups. Then we have Dr. Stephen Taylor, clinical psychologist at the University of British Columbia. Stephen has a strong interest in mental health, anxiety disorders, and the psychology of pandemics. His most recent book, The Psychology of Pandemics, was published in October 2019, around a month before COVID-19 began to spread. And finally, we have Dr. Renee Bengjin. Renee is currently focused on applying synthetic biology to outbreak infectious disease. She is the Vice President for Business Development at Ginkgo Bioworks. Prior to Ginkgo, she was a program manager in the Biological Technologies Office of the Defense Advanced Research Project Agency, DARPA of the US, where she leveraged the tools of synthetic biology, gene editing to enhance biosecurity, support domestic bioeconomy, and manage biothreats. Welcome to all of you. It's an absolute pleasure to have you. A super diverse and incredibly interesting panel, and I cannot wait to hear all of your opinions and comments. The final comment I want to make is that today's closing remarks will be by Dr. Michael Ryan, and Dr. Michael Ryan is the Executive Director of the World Health Organization Health Emergencies Program. Mike has been at the forefront of managing acute risks to global health for nearly 25 years. He first joined WHO in 1996 as part of a new unit to respond to emerging and epidemic disease threats. He has worked in conflict-affected countries and led many past responses to high-impact epidemics, including the current COVID-19 pandemic. And we will hear the closing remarks from Mike later in the roundtable. So, without further ado, I'd like to start the conversation and make sure that we, reflect on the scenarios that we've heard so far, ask a round of questions and engage in a conversation across the panelists. I'd like to start with you, Akin, the Honourable Commissioner for Health of Lagos State, and opening you up with a question. COVID-19 has highlighted the inefficiencies of siloed and disconnected practices at the local, regional, and international level. To reach scenario 1, the best case scenario, we really require a collaborative and interconnected approach. Can you highlight examples of actions which have helped achieve this?
So thank you very much, and hello to all the panelists and to all the listeners. So what we did in Lagos was, where you have distrust is because you are not involving multi-sectorial members of community in the response. So this was a global pandemic. It affected the whole world. It affected our entire state. It affected our entire country. And if you think as government that you can manage this magnitude of biological threat on your own with the typical bureaucratic slowness of government, which is there for a reason, try and manage a pandemic that's moving so quickly and is so dynamic, it will soon overrun you and you will run into problems. So what we did in Lagos was to quickly open up the response to multi-sectorial participation from the private sector, from civil society, from the academia, from the youth. We formed the dynamic think tanks, and as your opening remark where you said if you're not at the table, you're on the menu, that is so true of typical best practice response to this kind of scenario. So distrust comes when people don't know what you're doing. So if you bring everybody around the table early, you recognize your limitations as government, you know that this is going to be in excess of what your capacities are, you tap into private sector thinking, you adopt what the WHO have always been consistently advocating and move away from silo response to horizontal strategies like the One Health paradigm, where you look at the environment, you look at security, you look at economy, you balance the strategies of the public health with economic strategies, because if you are just going to roll out a pure public health response, then you will, without considering what the economic consequences are and subsequently what the security consequences are, then you may have scenarios that are even social scenarios that are even worse than the threat of the outbreak. So in Lagos and in Nigeria, what we did was to put think tanks together that were dynamic. They involved the community, so you can't have distrust when you're involved because everybody's at the table. We were very keen to get the youth and when you put young people around a table, they come up with incredible ideas, and these ideas are very useful to government. And the other thing we did was to take the response out of the usual bureaucratic mechanisms of public service. And we created what's called the incident command structure. And that is a fast track way of government addressing the dynamic changes of the public health scenario and making it very nimble, very stealthy, very adaptable. We used a lot of real-time data to inform the incident command structure, which puts the highest political leader of the state in charge of the response and also able to make day-to-day policy decisions surrounded by people who are informed and drawn from multiple sectors of society. So there's always distrust where you as government seem to be having all the answers, having all the ideas, trying to impose solutions on the public. But if you keep people informed, and also remember, we've never been through this scenario before. The last time there was a global pandemic of this magnitude was more than 100 years ago. I don't think there's anyone alive at the moment that remembers that. So it's okay to make mistakes, and as government, give yourself the leeway to make mistakes, but admit your mistakes and admit that you made a mistake in this scenario or you made a mistake here. Respond to the public very quickly, always keep in touch. What we did in Lagos was to almost have daily briefings, press briefings. There's a lot of social media activity. We're responding to all the public health, all the information coming in from the public. And we were admitting our mistakes and promising to correct them. And when you promise to correct something, then you must follow through. You must say, okay, within a couple of days, we're going to come up with a solution. And you must do that. And if you do that, then you engender the confidence of the public. You show that they're part of you, and that you have a responsive government that is dynamic. You're not trying to hide anything. You admit your successes. You take accolades for your successes, and you admit your mistakes and promise to do better. And I think if you carry on this way, then this disconnect, first of all, between community and government, and between various sectors of society, which is government and public-private sector connectivity and civil society. And more importantly, in Africa, we have a youth bulge. You must never let the youth out of the scenario. Thank you.
Thank you, Akin. So I liked a lot what you said about youth. I was going to ask you a follow-up question on that, but you've covered it already. And you also, again, highlighted the importance of systems thinking and the various components of the system. And then crucially towards the end, the importance of learning, admitting mistakes, and also engaging the wider communities around the lessons you've learned. Thank you very much. That was really insightful. Renee, I'd like to come to you next, if that's okay. Renee, scenarios 3 and 4 really show a lack of resources in regard to medical manufacturing capacities. What do you think are the barriers to increasing local medical supply in developing countries in particular, such as, for example, diagnostics and vaccine production, that could eventually improve self-sufficiency and perhaps provide more autonomy? Very interested to hear your views on that, Renee.
Yeah, thank you, Joseph. Thank you for letting me be here today and share my views. I think with regard to scenario 3 and 4 and just reflecting on the current pandemic, one of the surprises for me personally was how slow we were to respond in terms of diagnostics and testing. So in principle, we had some capability that was distributed globally that we didn't move quickly enough to implement. to get in place and really get ahead of that pandemic. It was already global and widespread before we could take action. What was not a surprise to me is that we didn't have the capacity to do global mRNA manufacturing. This is the first time that something like an mRNA vaccine has been used to generate billions of doses. This was, really fundamentally a risky approach to move forward, but the best chance that we had to be able to respond at this scale, and is really kind of one of the great stories of this pandemic. So in terms of resources to continue to scale and manufacture, I would say getting ahead of it and maintaining what I would call a warm biosurveillance base is really critical. We're building infrastructure during this pandemic to be able to routinely monitor and detect during an outbreak. This could be from swabbing and testing individual diagnostics. Pooled surveillance is a great way to measure many individuals at once in a cost-effective manner. And then, of course, things like wastewater and other passive monitoring approaches have shown to be a really useful way to look at large swaths of the population to understand spread. So, maintaining this to detect before we really have a massive pandemic or outbreak that would stress our manufacturing system, I think must be in place first. Second is really focusing on platform technologies that we can enable a pivot for a scaled response. So we couldn't have predicted 3 years ago that we would have had a SARS-CoV-2 pandemic, but yet we used a capability like an mRNA vaccine where we didn't even need to have virus in hand. We could take sequence information to directly begin to make medical countermeasures. And so this is something that we should continue to do and really increase a role for industry here as well to create this capacity. Of course, platform technology, these can be used for therapeutics for things like cancers during non-pandemic times, so that we can maintain this warm industrial base that can be called upon in the time of a pandemic to respond in a timely manner. Capacity building, I think, across nations, it doesn't need to only rely on nation states, but can start to really bring in industry here and help grow economies in the same manner as I gave the example for cancer therapeutics. We could be helping build capacity in developing nations to create new economic models that then they can pivot to be able to respond to a pandemic. And then one last point I'd like to make is really rethinking the way that we stockpile. So of course, we have stockpiles for PPE and masks and gloves is really important going forward. But thinking of things like mRNA vaccines, there are new raw materials that are needed to create those reagents, things like vaccinia capping enzyme that was probably used globally at MIG quantities. Is really needed at hundreds of kilograms now, and could be a resource that, if stockpiled, could be used in an agnostic way, regardless of what the threat is, as long as we pursue mRNA manufacturing as we go forward. Continuing to invest in those new technologies and innovation that may be nascent today that can help us really have a robust response to that next pandemic.
Renee, you mentioned pivot for scaled response. I guess, do you also mean some degree of capacity for agility, if that makes sense?
Absolutely. And I think importantly is keeping that capacity warm, that we have the workforce that's in place to that really knows how to scale these technologies, that can help reprogram. So really the promise of synthetic biology and gene editing is the ability to sort of update sequences to be able to move forward and elicit a desired response. And if we don't keep that workforce warm and able to respond, I think we're going to be really caught flat-footed again.
Thank you, Renee. Bruce, I'm wondering if you would like to build on that response a little bit. I'm conscious that you're working on an institute for future pandemic response and prevention. Keen to hear your additional thoughts on that and what we can do to better develop capacity and agility in that sense.
Sure. So I mean, there's already lots to build on. I think one piece I think it's worth commenting on, because it may be sort of an insider term. What Renee talked about is keeping these things warm. I mean, this is the idea that you can't just have something that's going to be available when the pandemic comes on, because you're not going to have the people, you're not going to have the experience. So the idea of these, whatever the facility happens to be, if it's a vaccine manufacturing or diagnostic or therapeutic, they have to be working all the time to make sure that they are able to respond in a pandemic and scale in a pandemic. which is probably an overarching principle, is that what we need from a pandemic, we need for everyday purposes as well. And we have to keep that in mind as we build these systems. Just to the point that Renee started into about diagnostics and surveillance, they're similar, but they're not the same thing. And I think on a surveillance part is we need a better global early warning system. You've mentioned what Rockefeller is participating in our Pandemic Preparedness Institute, working with other global players. And the principle there is the earlier you can find things, the earlier you can respond. That then gets into the importance of putting light where there's darkness, so make sure that there is data that can be generated from multiple places. And more importantly is the opportunity to then aggregate that data, share that data, and learn from the data in a larger fashion, which again gets into the issues of trust on the quote sharing of data. So I think it's a larger conversation, but it's going to be very important in the same way that we need to share viruses, or now we can just share sequences to rapidly develop vaccines. Those same insights are going to need to come from the data and the analytics that come from that data, not just the quote traditional public health data, but other data sources as well. Travel and trade, mobility, those are the kind of things that can help us better understand where there might be something that might be emerging.
Thank you, Bruce. And I'd like to just follow up with a slightly different question for you. Apart from scenario one, all the other plausible futures illustrate varying degrees of vaccine hesitancy, which is a continuing topic in many nations, including the UK, and an inherent inability of governments and public health organizations to effectively formulate a clear scientific message around the pandemic. Why do you think this is happening, and what role does multi-level and multinational collaboration play in this?
Well, those are three things that are related, but they're very different things. Let me just start with hesitancy. I think that part of the problem is that we sweep everything into a hesitancy basket without differentiating what is within that. If the core question is why are people not getting a vaccine that's available, then we need to try to understand that a little bit better. It may be that the services are not easy for people to get to, so we shouldn't quote blame them for hesitancy if the services aren't well provided for them. I think another piece is that hesitancy is something we need to have better metrics on. The scenarios talk about hesitancy, the rise and falls of hesitancy. We really can't measure it. And unless we can measure it, we don't know where we are. So we're going to have to really buckle down and have a clear understanding of where we are now and how we're going to measure hesitancy and how it changes over time. I would argue that we often confuse hesitancy and confidence, and they're very different things. So for example, if you have an understanding of how the system works, how science works, how the regulatory system works, how clinical trials are conducted, and you have faith in that process, then you can be confident in the system regardless of what a particular vaccine might look like coming through, but you'll then have to look at that as it works forward. So I think we need to sort of disentangle some of the words and have a clear sense of what the metrics are, and to better develop a better evidence base on what works and what doesn't in particular community settings and what might be scalable. As far as the difficulty formulating a message, I think that is a different problem. It may have to do with evolving science, and it may be that in a session that's about foresights, we should think about the importance of foreshadowing. To be able early on to say, listen, here's what we know, here's what we don't know, here's what we're working on, and we're going to keep updating this as things change, so you know what the evolving science is and what the evolving actions you should take are to be safe. Without that, it'll look like just a blur of conflicting science. I mean, we've all seen studies of everything from coffee to chocolate. One day they're good for you, one day they're bad for you. If you get this bombarding about the conflicting science, at some point you just give up. So I think we have to be clear about what we're learning and how we're moving towards quote the truth to be able to understand that. And then the last part is about what's the role of sort of the multilateral sector. I think it's to take a step back, to take a look at this big picture, to recognize that a pandemic, while it sounds like it's the same everywhere, it is not. And to be clear that a pandemic is going to play out in different ways in different communities for a whole bunch of reasons, that needs to set the frame, and then it's up to the communities to define, based on some important indicators and the data they can get, is where they are in that pandemic. And then finally, to make sure that this work, the work of providing the data, sharing the data, analyzing the data, and developing the evidence is well supported.
Thank you, Bruce. A lot about data and better metrics as well, which hadn't come up so strongly before, which is very useful. Thank you very much. I'm firmly in the camp that believes that chocolate is good for you, but I'll let everyone make their own opinion on that. Alison, moving on to you and asking you a question. What has the COVID-19 pandemic in various scenarios that we have laid out highlighted to you about the key fragilities of the global supply chain?
Thanks, Joseph, and thanks so much for the opportunity to be here. I agree. I hope coffee and chocolate remain okay for us to continue, because it would be a very sad world if we had to give those up. I think, like other supply chains, the healthcare supply chain is designed for maximum efficiency, not to deal with crises. And as we've seen over the past 20 months, and I think as is demonstrated in your scenarios, this just-in-time design of the healthcare supply chain means that it's quite fragile, and can be, very dangerously impacted by anything from, we've seen with the COVID-19 pandemic, but natural disasters, geopolitical events, labor issues. For example, in the United States, we have a major shortage of individuals in the trucking industry. Raw material shortages. Renee, you were talking about raw material shortages related to diagnostics and mRNA vaccines, as well as regulatory challenges. And, the COVID-19 pandemic really was in some ways a supply chain perfect storm that put, significant stress on the supply chain, not only in the early months of the pandemic, but there are issues that we continue to face. And I think they impacted your 4 scenarios in various different ways. One, we saw the tremendous risk that's posed by regional concentration of raw materials and manufacturing for key products. For example, the vast majority of masks are manufactured in China. 90% of the world's gloves come from Southeast Asia. We saw the impact of human behavior on the healthcare supply chain. So, everything from panic buying and hoarding to sort of irrational market in general for PPE, for example. Individuals buying and countries and companies buying massive quantities of PPE and really sort of warping the market. Rapidly changing government restrictions on transports and some lack of transparency around restrictions, which really caused serious challenges as well. But I think what your 4 scenarios really highlight is that we have the power to take actions to push us either towards your best case little happiness scenario or the nightmare last scenario or somewhere in between. I think both Bruce, Ryan, Renee, and Akin actually also have all pointed to the importance of collaborative public-private partnerships as really a critical tool to push the world towards that best case scenario that you described. There are several public-private partnerships related to the supply chain that I'd love to talk about as our conversation continues later in our session. I think these types of partnerships are essential to sustaining a resilient and ethical supply chain, which is so critical to our response. Bruce, you referred a few times to the importance of sharing data. That's a key theme in these partnerships, which I'd like to explore later in our session. And Bruce and Renee, you both talked about the importance of keeping capacity warm. You were describing that with respect to manufacturing and various platforms. Also think this is critical with respect to supply chain and keeping the partnerships that are critical to building the resilience of supply chain. We need to keep those warm. We can't episodically partner and then as soon as a crisis recedes, let those partnerships fall apart, because we need to be constantly vigilant and at the ready. And as you described, Joseph, and your scenarios really highlight, we don't know what the future has to bring, and the next pandemic will not be exactly the same as the one we're facing now. And so without a warm supply chain set of partnerships and collaborations, we will continue to face the same issues in the future. So thanks very much.
Thank you very much, Alison. So again, the importance of partnerships and communities coming through very strongly here. Your Grace, I'd like to come to you next and build on that a little bit. Also, from the context of citizenship and the role of communities. So, Your Grace, a big part of our pandemic preparedness really depends on community empowerment, especially in areas such as communication and trust between citizens and the government. In your view, what is the role of faith leadership in empowering communities and strengthening trust between citizens and governments? And how could this really help us be more prepared and move towards a more positive future?
Thank you very much, dear Joseph, and the fellow panelists, and all of you. I greet you in the name of our Lord Jesus Christ. From Uganda, it is almost 6 p.m. I want to greet you. In Uganda, I am the Archbishop of Uganda with a congregation of almost 14 million people out of the 45 millions in the country. But we have Roman Catholics, we have Orthodox Church, we have Muslims, we have Seventh-day Adventists, we have Pentecostals, and I am the chairperson for Council of Presidents for Inter-Religious Council of Uganda as well. We are doing a lot together, working together in collaboration, coordination, also in connection without thinking about our denominations. We work together for the common good of our people. And because we are a faith community, we are respected by many people. So when we had the attack of COVID-19, the president of Uganda and his ministers invited us in the State House, and we had discussions before the lockdown. And after that, we all agreed, after understanding how dangerous the virus was. So on Friday, it was announced in all mosques, no more worship. On Saturday, Seventh-day Adventists announced. On Sunday, Catholics, Pentecostals, Anglicans. And so because of that collaboration and the trust, the country was locked down for the goodness of our people. So we are respected. Secondly, we have another role of shaping attitude. Like recently, people were not respecting because of propaganda. They could not believe in the vaccination. There was a lot of propaganda. When you are vaccinated, you are going to die. But the first person and my few others who were vaccinated was me. I got the first dose publicly together with the other pastors. That day, 237 were vaccinated. And because of that, all people in Uganda have accepted to take the vaccine. In mosques, in Roman Catholic churches, and now we have 2.5 millions vaccinated. We are actually in a shortage of the vaccine, but people are really eager to be vaccinated. I am happy some countries are coming out to help us. But because of the faith leaders, religious leaders, we can call people. Just one weekend, we mobilized and invited people to come and get vaccines every after worship. And our places of worship were offered to government for people to be vaccinated every after a worship service. And just one weekend, 7,000 people were vaccinated. So the faith leaders have influence, and we can raise awareness. We do raise awareness to the people using our pulpits from Friday, Saturday, Sunday, and all gatherings like funeral services, maybe weddings. We talk about how people could be safe. And now we talk about social or strategic social distancing. We talk about wearing masks all the time. We are the one to begin. And so we use our influence. We also motivate and educate our people so we can help the government to be connected to the people. And we help the people to be connected to the government, to the citizens. So we work together. And we also use our literature. We use literature to send the people. We use pastoral letters. We can have one pastoral letter signed by a sheikh, signed by a pastor, signed by a Roman Catholic father. And this one letter goes to all our people. And that's how all people get trust and they participate.
Thank you very much, Your Grace. That's fascinating, and it really shows the power of communication, the power of trust, the power of networks, and of course also the power of faith and faith leadership. That's really appreciated. Thank you, Your Grace. Stephen, I'd like to come to you next. A slightly different perspective. Scenarios 2, 3, and 4 all illustrate a future where our mental health suffers significantly. So let's talk about COVID-19 for a second, also as a global human experience. In your opinion, Stephen, what are the psychological threats of the pandemic as we're experiencing it, and what will be the psychological footprint in its aftermath?
Thanks, Joseph. When it comes to pandemics or mental health associated with pandemics, we're not in all this together. Different groups are impacted differentially. People who experience extremes of crowding or isolation during lockdown, for example, have a very different mental health experience than people who live in luxury. That said, however, most people are resilient, and as a species, we've survived countless pandemics in the past. Research on traumatic stress experiences show that most people do bounce back. But that said, a significant minority develop psychological problems like mood disorders or anxiety disorders. And for COVID-19 in particular, we're not going to see the full impact of that for some years to come. Research suggests that for reasons we don't completely understand, that the mental health burden increases over time for some individuals. So we'll see some lingering effects. For the future, one of the big concerns has to do with pandemic refugees. If there are disparities across countries or communities, people will flee to places they think are better off. They might flee to places where they think they can have a better chance of getting a vaccine. Now, fleeing has been the prototypic response in past pandemics and happened during COVID-19 and will happen during future pandemics, particularly if there are disparities. So, as mentioned earlier on by somebody, we need to be proactive about mental health. So far during COVID, there's been very little proactive work done on setting up mental health programs. It's been largely reactive. So this is something that fundamentally needs to change to prepare for future pandemics.
Thank you very much, Stephen. So a lot about different experiences, us being resilient, but the interesting comment I thought was really that the full impact is yet to be seen in the coming years. And I guess again for us to be aware of the metrics and information around that so that we can formulate an effective response. Ricardo, coming to you now. Very, very good to have you here. We've got COP26 happening at the moment in Glasgow. Scenarios 3 and 4 describe a future where climate mitigation is not a priority. In your view, what key actions should be undertaken to ensure that the COVID-19 pandemic does not overshadow all other emergencies, and that we, I guess, approach this a little bit more holistically when we manage global human crises?
Yeah, thanks very much, Joseph, and a pleasure to be participating in this very distinguished panel. I have to say that, of course, we cannot see things in a silo. And already, while we have been suffering from the pandemic and the pandemic response and recovery, there are many countries around the world that have been also confronted with other shocks or disasters from different types of hazards, be there natural or man-made hazards. And of course, climate change being an amplifier of disaster risk, I think the discussions that are taking place currently at the COP26 in Glasgow are extremely important, particularly when it comes to, of course, not only mitigation, but also adaptation. And we have seen also that based on the scenarios of climate change, the impact on human health can be, quite significant, and can actually generate the right type of setting where other pandemics can actually flourish. So things are absolutely interconnected. We are currently speaking about the systemic nature of risk. And I think that in that sense, the pandemic is a textbook example of how risk is interconnected and how one type of hazard can create cascading effects that reverberate across literally all sectors of society. So we have to think multi-hazard, and this is, I think, a threat that the pandemic poses in the way that everybody tries to focus on pandemic and then think about, what are the forecasts for other pandemics of happening and how can we better prepare for it? While in reality, we should be looking at all hazards and the possibility of the combination of hazards that can potentially create scenarios that will strain the capacity of countries to respond. So I think that both in scenarios 3 and 4, if the COP26 doesn't reach an agreement to actually limit the increase of global temperature beyond the 1.5 degrees centigrades, then those two scenarios can actually become even more intense and unpredictable. So I would say, let's not look at things in silo. Let's try to work in a systemic fashion. I like very much a comment that was put by some of the people that are listening to this panel in terms of the fact that we are not only living in a VUCA world, as you mentioned at the beginning, Joseph, volatile, uncertain, complex, and ambiguous. But in response to that, we need to have also a VUCA response, but VUCA meaning vision, agility, clarity, and understanding. So we need to start on that basis to being able to look at this problem in a objective fashion.
Great, thank you. I did also. I fully agree with that. Audience comments was fantastic from Alessia. I do want to ask you a quick follow-up question, Ricardo, and this is this idea of systems thinking and system-based approaches to the complex challenges we're facing. What can we do around that in terms of further capacity building? Because it seems to be something that we we all need to get our head around a lot more.
Yeah, we are working not only within the UN system, but we are also working with our member states to try to support the implementation of the global blueprint for reducing disaster risk, which is the Sendai framework for disaster risk reduction. This is a UN member states agreed global framework that was adopted in 2015. And the Sendai framework clearly spells out the need to actually look at multi-hazard risks, generally speaking, not only from the early warning perspective, but also from the governance perspective, from the understanding risk perspective, and actually from every angle of disaster risk. So what we are saying is, we cannot look at hazards individually, and we cannot do just probabilistic risk for one hazard, because we may actually be affected by another hazard that we didn't put on our radar screen necessarily. And then whatever efforts you do for just one hazard that may be the most frequent and recurrent type of hazard in any given place, but to be open to the possibility of having, this combination of hazards happening at the same time in the same location. So this is what we are doing, and we have developed what we call the Global Risk Assessment Framework that we are applying even for the cooperation frameworks that the United Nations has in program countries to help them better understand risk and make development decisions based on that, more elevated understanding of systemic risk.
Thank you, Ricardo. I'd like to just quickly switch to some audience questions and comments, and perhaps the first one for you, Renee, or any of the other panelists, really. China detected the virus as early as the beginning of January 2020, but the world really didn't wake up before the situation was described as a pandemic. So early warning was there, but how do you better manage or increase the message of alertness across the world? Renee, I don't know if you want to comment on that first from your perspective, and then perhaps we can have one other view.
Yeah, I think it's a great point that there were some early signals that we didn't necessarily act on quickly enough because we didn't have the infrastructure in place to do so. I think that's changing now. A lot of genomic epidemiology is really starting to scale. But I do think we still need to address some of the challenges with data sharing, especially internationally. If we want to get to the point where we can sort of forecast and do true epidemiology, we have to create incentives for nations to share that information as early as possible, and then make a quick assessment of is this something that we really need to be concerned about by looking at precedent from past outbreaks, if we can understand what those sequences mean and are doing. But then also prospectively, if it is truly a sequence that we haven't seen before, what are the tools of bioengineering and synthetic biology, again, that we can quickly assess and characterize if something is a threat that needs to be taken more seriously. I'll speak more on that later, but there's a lot of challenges in working on that, from dual use research of concern, gain of function research. How can we start to really understand and characterize new threats so we can understand what are those actions that we need to take next.
Thank you, Renee. There's another audience question regarding the dichotomy between urban and rural areas. And the question is, do you see the possibility that all the four scenarios are going to happen contemporarily together, depending on the specific areas we are living, which differs for services, instructions, etc. So I can answer that one from a scenarios perspective. So yes, there is always a possibility that elements of each scenario is happening at the same time, or it's happening more or less in different regions. It is part of the benefit of scenarios in that you can also imagine multiple contemporary futures happening in parallel, but hopefully each of the scenarios gives us some lessons to be learned and some recommendations to make, and that can then be contextualized based on the context that you're working within. Akin, just one quick question for you that was raised here. How can governments engage with the population honestly and factually amidst internal and external political influence? A quick answer to that before we go to the results of the poll.
Yes, I think that's a very good question. What we did in Lagos was to use civil society and we got a lot of young people in on a civil society social media platform. We engaged. I mean, that's the new platform for communication, press briefings and social media. So we put a lot of information out through social media, and we got a lot of feedback through social media. And that really helped us to craft our strategy moving forward.
Great, thank you, Akin. So it's time for us to see the results of the first poll, and then I'd like to have a quick fire round, perhaps, of all the panelists to quickly just say which scenario you feel is most plausible. So the audience question one was, which scenario do you think is most plausible? There's a clear winner, if you like. I love you, I hate you, with 58% of the vote. Scenario one, the best case, only 6%. Actually, more people thought that the worst case scenario, here comes trouble, was more likely. And then the second most likely is Heartbreak Hotel, which is obviously a worsening of our current situation, if you like. Any quick reflections from each of the panelists? Do you agree? Do you feel another one is more plausible? Who do we want to start with? Ricardo, do you want to go first? Which one do you think is most plausible? Any quick comments?
Sure. I was actually also going to vote for scenario number 2, and then I noticed that I couldn't click the button for panelists. But yeah, I think, I'm a positive and usually optimistic person. So I want to give a vote of trust and confidence to science and the capacity of technology to help us manage this COVID-19 pandemic. And this is why I believe, and I really hope, it's a mixture between I believe in but hope as well, that we don't go beyond scenario 2. So scenario 1 is probably a bit too much optimistic. Scenario 2, I think it's plausible, it's doable, but it will require a lot from everyone. And in that sense, I think that multilateralism has to continue being prioritized as the best way to handle this pandemic. And there needs to be, of course, stronger and more forthcoming support from particularly rich countries to ensure that there is equitable access to vaccines, diagnostics, and therapeutics. This is actually something that the Secretary General has clearly outlined, and we need to have a global vaccination plan that includes increasing manufacturing capacity as well. If we don't manage to get this, then we may slip into scenario 3. But as I said, I would like to stay with the optimistic view that scenario 2 is the most plausible.
And hopefully we can somehow move in the direction of scenario 1. Let's see a few additional views. Alison, I wonder which one did you think was most plausible?
Yeah, it's interesting, Ricardo. I agree with you completely. I was leaning towards scenario 2 out of an abundance of hope and a prayer that we don't allow ourselves to descend into the more tragic scenarios. But I will say, Ricardo, I agree with you completely. To stay in a scenario 2 requires constant vigilance, sustained resources, sustained focus. This will not just happen without absolute laser of focus from all sectors of society and collaboration, and also an attention to that interconnectedness of risks, Ricardo, that you spoke about earlier, because any set of risks can sort of set the spiral towards those worst scenarios. But I will say that there's always the danger that a new pathogen can appear. So, scenario 4, where Zika is the new pathogen. I mean, we need to be forever vigilant and focused, because that can easily happen. And we need to be able to respond in a cohesive, swift way to ensure we don't descend into a very tragic scenario. So my hope is number 2.
Great, thank you. And Your Grace, quickly with you, you think scenario 1 is achievable? You're muted, Your Grace. There you go. Yeah.
I have been wondering about scenario 2 also, because it gives me some thoughts on balancing this side of faith, the side of science, bringing everything together. And so people of faith definitely, I was also wondering about scenario 4, troubles that we have encountered, closure of schools, churches, and also death of people. But I think scenario 2 covers most of the things that we could do in our country.
Thank you, Your Grace. Okay, we'll use that as a segue to think about, I guess, the conversation in a slightly different way and move away from the scenarios into a future view on what we can do better. So really talking about strategies for global action and recommendations for a way forward, both to mitigate the risk of the current pandemic better, but also to be better prepared for future threats. Stephen, I'd like to start with you for this round. So Stephen, it would be great to get your thoughts on the future of public health and social measures. What happens, for example, if strict lockdown measures, mask mandates and social distancing continue perhaps for another year or more, or become even the norm or something society now must live with? You know, how do you think this could impact social mental health and wider human behavior in the months and years to come?
Well, we saw from COVID-19 and from past pandemic that lockdown is bad for your mental health. People are naturally gregarious and social, and when you inhibit that to stem the spread of infection, you get a rise of mental health problems. So I guess one of the big challenges ahead, I'd find more tolerable, effective ways of implementing lockdown, because if the lockdowns persist, you will get an increase of non-adherence or an increase in protests and rebellions and societal disruption, which will make the problem even worse.
Thank you, Stephen. And I'll just, one follow-up question, I guess, then based on that, in the future, how can we really effectively design and implement mental health programs and services to support people, who are dealing with the protracted impacts of COVID-19 and perhaps build more resilience for the future?
I think the first thing we need to realize is that mental health is impacted by all levels of society. So it's not just sitting in your psychiatrist or psychologist's office getting help as an individual. We need to construct societies that are better at preserving people's mental health, and importantly, societies that foster resilience and realistic optimism to face the challenges ahead. What we've seen during COVID-19 is a move from one-to-one mental health services delivered in a clinical office to online services, but we need to go a lot further than that. Our mental health system globally has been broken for a very long time, where it's been a system that can be accessed by the wealthy, and that needs to change a lot. We need to be better at reaching people in rural areas, free services, and so forth.
Thank you very much. Thank you very much, Stephen. Ricardo, I'd like to get back to you for a second and just go bigger picture for a second. And ask the big question, how can we build a more effective global system that ensures we are coordinated in our preparation and response to future pandemics? And it builds, I guess, on a lot of the comments we've heard already.
Yeah, I think WHO would be best placed to respond to this question, but I think that some of the experts and the independent panel to review on COVID-19 response has also made recommendations in the sense that there is a need to have a global setup to work on not only the preparedness but also the detection of catastrophic communicable diseases, and I think that there are many instances for different hazards that already have some sort of global response systems. One of them, for example, deals with forest fires. And this is a collaborative approach using the capacities and capabilities of individual member states that together can deal with these issues. Also, this can be parallel can be made with the capability that is being developed by member states to have a global alert system for hydrometeorological events. Although it's not there yet, it's being built. So in that sense, I don't see why not. But again, my point when I had my first intervention is that it would be a bit narrow-sighted if you only look at a preparedness system to respond to one single hazard. The multi-hazard approach that I was talking about should be prioritized, and hence the capability of the different parts that would make that system need to take that into account as well. But as I said, this is more a question perhaps that WHO will be better placed to respond.
Thank you, Ricardo. Okay, another big question, this time for you, Bruce. Public health response to COVID-19 pandemic has intrinsic political and cultural characteristics. In the future, Bruce, how do we operate successfully at the intersection of science, politics, and policy to formulate an effective public health response?
I think that's exactly right. It is that intersection of those three. Of often we think about science and policy intersection, but politics layers into it as well. Actually, I just have to say that I throughout this, and I particularly wanted to hear what Ricardo's answer was to the scenarios. And maybe the bonus question for everyone is what keeps Ricardo up at night, given his job. But I think that what he's emphasized is the system aspects here, and that gets back into this point here about science, policy, and politics. Is that I think a lot of us have had opportunities to sit at that interface where decisions get made based on the combination of those three things, and there needs to be a recognition that those go into those decisions, and it's not pure science. But I do think that the recognition of where science comes into play to lay out what the options are going to be for the decision makers is critically important. That gets into this larger issue of what's come up here, which is I think one of the lessons for the future is how we're going to make sure that there is better access to the things that are needed in the future. And that's part of that discussion as well, recognizing that at a national level, politicians are looking out for their nation and first. And how we then sort of factor that in to sort of global needs as well. I think that's a longer discussion about the capability and the capacity, but we need to lean forward. A long way of saying is that my vote, if you will, on scenario 3 is I think that all of these are feasible, but I think from a planning purpose and for purposes of this exercise in foresight, we need to dissect out those things which are truly feasible and try to get ahead of them so we can think about some of those solutions, because the one you raise is going to be critical as well. At the heart of it is what we've seen with vaccine nationalism, and we've gotten into a bind because of that, and hopefully that is going to be resolved as the supply increases, but we can't afford to do that again.
Great, thank you, Bruce. And one of the panelists on the previous roundtable spoke about it as, the reality of medieval kingdoms, and the idea of how future anthropologists might look upon us in terms of how we might manage the pandemic at the moment. And
there's a long lesson of what in the tragedy of the commons that was written about almost 200 years ago, and I think we need to take a look at those lessons, because with our globally interconnected society, that's the commons, and we need to try to figure that out. There have been Nobel Prizes on that topic as well, but we need to turn those into true political action.
Thank you, Bruce. Your Grace, I'd like to come to you and perhaps focus on the importance of youth again for a second. So, Your Grace, with 41% of the world's youth forecasted to be in Africa within 3 generations, how can faith leadership harness the youth's potential to catalyze the overall process of public participation in the wider public health response?
Thank you very much. Definitely, the issue of mobilizing the youth is very important because they are very, very zealous. They have the energy. We have IT experts. It's from their groups. And also, as I already said, we have that influence. We can use the pulpit, and we can work together with the government and our societies to ensure that we empower the younger people and also help them to participate in all things connected to public health, because they are able. And the best way to do it is using our faith organizations, but also the government as we work together. Because what I discovered is that communication, collaboration, coordination, cooperation, connection is very important if we are to make any influence in any given society. And for public health, that's the way to go as well.
Thank you, Your Grace. Alison, coming back to supply chains for a second, and I guess, you know, the contextual question here or factor, we rely on medical supply chains to bolster human health, as we have seen throughout this pandemic. There are also aspects of supply chains, from the treatment of labor to associated greenhouse gas emissions, which are, you know, tied to the production and transportation of these supplies, that perhaps themselves can jeopardize human health and well-being. You know, what do you think needs to be done to realize more resilient medical supply chains going forward that are also more ethical and advance equity?
Yeah, thanks, Joseph. I mean, in the context of our conversation today, I think, you know, especially given the comments about sort of the interconnectedness of risk and the importance of not working in silos and recognizing all the various potential impacts on the critical infrastructure that we need to respond. You know, I think there are three key issues with respect to building ethical and resilient supply chains I'd like to flag today. One is climate, which you referenced. Another is human rights, and another is equity. You know, I think there's no greater threat to human health than climate change. I believe the WHO report recently, you know, really underscored this fact. And so, you know, the horrific nightmare scenario of number 4, you know, there's no question that climate absolutely will contribute to really quite devastating health impact. And you know, the health and life sciences sector is actually a major source of greenhouse gases, as you referenced. And you know, environmental sustainability has to be a critical pillar of how we build resilient medical supply chains. And I think, you know, just obviously we can't dive into this deeply today, but clearly accelerating action to achieve net zero emissions, including bold efforts to reduce the carbon footprint of the healthcare supply chain, and making the needed investments in renewable energy are critical. There's also, you know, always human rights concerns in any supply chain. And unprecedented stress on the healthcare supply chain, I think, exacerbated some of these concerns. And so all actors that have a role in value chains have to have, you know, crystal clear standards within their businesses and requirements across their partners. And lastly, you know, from an equity perspective, you know, I think equity in some ways sits at that nexus of climate, human rights, and healthcare access and system strengthening. And so I think it's really critical that we overlay an ethical, you know, equity lens over all of the work that we do together. I do want to comment back on the supply chain topic about data and the importance of free flow of data. There are several partnerships that have been initiated. One, the Pandemic Supply Chain Network, which was initiated at the World Economic Forum and led by the World Health Organization. I know we'll be hearing from Dr. Mike Ryan, who has really led the charge with the Pandemic Supply Chain Network. But this platform has really shared data across various players in the healthcare supply chain. And I think it highlights the importance of understanding the various market dimensions, demand, supply, capacity. All of those things require sharing within the private sector, across the private sector and the public sector, and require trust. And so I think it points back to the concept we discussed in the beginning, which is that none of these platforms that we build to respond can be episodically stood up in a moment of emergency. They need to be sustained. Trust needs to be sustained so that we can have the free flow of information, collaboration, and cooperation that we need to respond swiftly, so that we ensure we can identify quickly emerging threats and respond quickly.
Thank you, Alison. So again, systems warm. Renee, a slightly different question, but one I'm very interested in hearing your answer on as a former biologist. How could biotech and bioengineering be used to prevent scenarios 3 and 4? And what role could biosecurity and gene editing play in pandemic preparedness of the future? So an emerging technologies question for you, Renee.
Yeah, I think looking at the current pandemic, I think one of the interesting observations for me has been, if you look beyond COVID-19, there's fascinating things that have been happening with influenza. In the United States, for example, there was less than 2,000 cases last year, given a lot of the interventions, of course, that were in place for COVID. So I think there's a lot of learnings there that we can leverage going forward, whether it's for epidemiology or beyond, and something that we haven't seen a concerted effort to really focus on that. One way for us to make progress, I think, if I put my old DARPA hat on, where I was working with the U.S. Department of Defense, the Department of Defense has a habit of, on an annual basis, doing military exercises with allies and partners across the globe to make sure that protocols were in place, agreements were in place, and understanding and training was in place to be able to cooperate and work together. And so that's something that really, in a very active and practical purpose, doesn't happen on an annual basis for pandemics. Of course, every year there's more than 200 epidemics that occur globally. And so it's an incredible opportunity if we start to run some of these exercises where we begin to keep capability warm, show our ability to pivot through bioengineering, synthetic biology, and grow this capability. Not only could we be addressing some of those epidemics that are popping up, but it helps us, create those muscles across academia, industry, and governments that we can respond better and more effectively to the next pandemic. So I would love to see that happen as we move forward. And then if we're really leaning into future thinking, you mentioned gene editing technologies, and I'm very excited about a few emergent technologies that haven't yet been able to be implemented to address this pandemic. But things like RNA editors that can directly target viral sequence and shred virus could be something that we could use as a tool in partnership with vaccines. And so what I mean by this is, we know from current vaccines that individuals can still get infected, for example, with SARS-CoV-2 and shed that virus. If you partner that with something like an RNA editor therapy to inactivate and neutralize that virus, you could really have dead end in patients to prevent that further spread of virus. And so this is an up and coming technology that's not quite ready there, but we should be continuing to invest in. And then furthermore, in the gene editing, there's new emergent technology that does not allow for permanent alteration of genomic sequence, but rather transient increase or decrease in gene expression. And where something like this might be helpful is if you think about receptor targets for viral entry into cells, if we could silence those receptors, let's say in our lungs, for a short period of time to actually even prevent viral entry, these types of new therapeutics could be an interesting, way that we can address a pan-viral response that would be more robust to against emergent variants that could be evolving from this in future pandemics. So again, heavy leaning into the future thinking here on gene editing, but I think it's important that we address that. Again, looking at mRNA vaccines and the surprise that they became really the superhero of this pandemic. We need to be looking out for that next superhero.
Great. Clearly a lot happening in the RNA world, and yeah, perhaps something for us to build into the scenarios again. Akin, I'd just like to, I guess, build on the technology conversation for a second, because recognize you're an expert in biobanking and keen to hear a little bit more about that. So in your view, Akin, how has biobanking been used to understand and respond to COVID-19? And what challenges and risks currently stand in the way? And what changes need to be made to make it more effective?
Yes, thank you. And I just want to briefly comment on the logistics and the synthetic biology responses we just had from Renee and Alison. I think there's not enough communication around synthetic biology to the community. It really breeds the fuel of conspiracy theorists, which then drive the public in a direction of mistrust. And I think while we're all busy in the laboratory, in our biosafety laboratories, tinkering around with DNA, it's very important that we communicate with the public. I know it's advanced science and sometimes difficult to understand, but we need to break that down into common English and put it out there to show that synthetic biology is essentially meant for the positive good of humanity. And, we're trying as collective scientists with ethical concerns to limit the possibility of dual use. And then moving to logistics, we found in Nigeria that logistics was almost 70% of the response. If you don't have good logistics, you don't have a response. And that takes me straight away into the biobank. The biobank is important for us because, first of all, we have a biosafety level 2 and biosafety level 3 biobank hybrid. That's actually a net zero facility. It operates purely off grid. So that's in keeping with the COP26, where I'm in Glasgow at the moment. But we built that biobank after our Ebola experience because we knew that a mega city like Lagos, if it didn't have the diagnostic capabilities and the biobanking and the ability to interrogate novel pathogens, that we would be in big trouble. So luckily that facility was ready just in time for COVID, and it actually became the nerve center of the Lagos State, Nigeria response. And every single positive case that has been identified in Lagos has been kept in the biobank. It is the regulator of the private sector. So the biobank controls the participation of the private sector, expands our capacity. We keep all the samples, we've got all the data. So looking backwards now, we can collaborate with the rest of the world to find out, for example, why was the outbreak so different in Africa compared to the Northern Hemisphere? We have very low fatalities in Africa, but it still affects just as many people. But in there may be the solution, it may be the cure. What is different about our environment? Why does it kill so many more people in the Northern Hemisphere and not so many around the equator? Thank you.
Thank you very much, Akin, and thank you for joining us during COP. And yeah, good luck with the rest of the event. Okay, we have some more exciting things to do before we have to close. 3 more things. Of course, we're going to have the closing remarks from Dr. Mike Ryan. Before that, we have the next audience question. So this one, I'm just going to share my screen quickly to explain to you what the question is before it will pop up. So this question for the audience and for the panelists is, what do you think will have the biggest impact on better pandemic preparedness? Universal health coverage, sustainable funding for global pandemic preparedness, global data collaboration, which came up a lot, strengthening of national healthcare systems and capacity building at the local level, investment in health R&D, climate mitigation and adaptation, political commitment and international and multi-sectoral cooperation. So the poll will pop up. You will be asked to choose one. Of course, they are all important, but very, very keen to hear your thoughts on that. While you vote, we will have a so-called quick fire or lightning round. So this will be one sentence per panelist. So this will be a challenge for all of the panelists now to capture their responses in one sentence. And it's always the case that, you know, who goes first has it the easiest, because yeah, if you go last, some of the things might have already been mentioned. But the question for all of you panelists is, what is the one thing, if you had to choose one thing, we need to get right to be better prepared for future pandemics? So what is the one thing we need to get right to be better prepared for future pandemics? And I'm just gonna choose a random order this time. Maybe Your Grace, I'll start with you. What's the one thing we need to get better in one sentence? Your Grace, if you're still there. Okay, I can't see the connection now, so I'm gonna go. Oh, there you are. Okay. Yes.
Thank you very much. I was thinking about commitment for politicians and international matter sector people working together. And this actually brings all the professionals together, everyone to be a sisters or brothers keeper, so that we put all our monies, our energies, our intellectualism together, working together, religious sectors, politicians, academicians, and all of us. Thank you very much.
Thank you, Your Grace. Stephen, you're next. One or two sentences max. The one thing we have to do.
Okay.
Better prepared.
Well, pandemic mitigation requires people to work together. That's a no-brainer. And so governments need to find ways of earning the trust and cooperation of its citizens. Otherwise, pandemic mitigation is not going to work.
Thank you. So trust in citizens. Renee, I'm going to jump to you next.
Yeah, I think the one thing that we need to get right is really understanding that biosecurity is bioprosperity. It gives us the ability to address the bioeconomy, find capabilities that are useful in non-pandemic times, so that when the next pandemic occurs, we're going to be able to respond. And recognizing that as an incentive is going to be a really important path forward, I believe.
Thank you, Renee. And Akin, you're next.
I think, you know, it's not just because we're on a WHO platform here, but I think the One Health paradigm really is the solution. And that's the horizontal approach rather than the vertical approach. Get all the agencies together. Don't forget private sector and civil society. And our youth are really the key. They have been the ones that drove the Lagos State response, and they've been incredibly useful to us, and we must keep them in the conversation.
Thank you, Akin. That's great. Ricardo?
Yeah, I would say, of course, I'm biased because of my agency, but I would say that we need to do the paradigm shift from managing disasters to managing disaster risk. This is the key.
Great. Thank you, Ricardo. Alison?
Yeah, I mean, I just want to go back to the importance of not allowing ourselves to fall back into the typical pattern of panic and neglect. We are all laser focused on response, but we can't allow that laser focus to dim as you know, time goes on. And the other thing I just want to say is, you know, Dr. Tedros, I believe, said at the World Health Assembly a few years ago that UHC and global health security are two sides of the same coin. So I think building resilient, equitable health systems is critical to any response in the future. Thanks.
Thank you very much, Alison. And finally, we have Bruce.
You know, I think central to this is the political commitment and working together. Without that, any of those other things will have advantages, but they'll be limited. So I think that's the part that's really essential to that. Behind that is trust. Now, there's a lot of ways to go at that, but unless trust is part of the system, that's also going to be limited. But I'll pick on one piece that I think going forward embodies many of those things. It's come up as a theme already, but I think that looking at data and the various sources of data and the importance of that data for our risk assessment to know as soon as possible what the risks are, and then for using that data for the many different ways for risk management. Unless that data is assembled and analyzed and done efficiently and quickly, we're always going to be behind the curve.
Thank you, Bruce. Okay, let's get to the results of the poll. If the WHO team could please bring up the results for everyone to see. That would be great. Okay, so audience question 2. The most votes went to strengthening of national healthcare systems and capacity at the local level. After that is political commitment and international and multi-sectoral action, which was also mentioned by a lot of the panelists. Universal health coverage, 20%. Sustainable funding for global preparedness, and then data collaboration, climate mitigation, adaptation last, and then investment in health R&D. Not needed anymore. Perhaps, Renee, you convinced people that everything was in order and all the innovations were coming our way. So maybe that's why that one didn't get too many votes. Look, before I hand over to Mike for some closing words, I just want to again thank all of you for your participation. We've had some really excellent questions from the audience, and also some comments and some suggestions for refinement for the scenarios from the audience. It's really, really appreciated. We will be working on our technical report in the coming weeks to finalize that and to make sure that all the feedback and the outcomes from this roundtable are included. We do have your contact details through the event sign up, so we'll be sending you that report when it is published. And we're working towards the World Health Assembly to make sure that some of the things we've discussed can also be hopefully fed into that. So a massive thank you to the audience for being with us. A massive thank you, of course, to the panelists. You were all fantastic. Some really great and important views. And so for the closing words, the summary and perhaps some reflections, I'd now like to hand over to Mike. Mike, over to you.
Thanks, Joseph, and thank you for your leadership and the work of Europe and other partners and our colleagues in the STAG-IH, the Strategic and Technical Advisory Group on Infectious Hazards, working with Sylvie's and the whole group to bring this together. It's interesting. I've really enjoyed the last 2 hours, and I think it's the first time in many months that I've actually just sat back and just listened to some really smart people talk about this pandemic. And it's incredible. The busier you are, the less you think, which seems counterintuitive, doesn't it? And the less you think through what you're doing. You know, we do tend in crisis to enter automatic mode, and that's important. Learning how to react to a crisis in a practiced way is very important. But everything changes during an emergency, whatever that risk is, Ricardo, whatever that disaster is. It starts out a certain way and it never goes quite the way you think. And that ability to react and adapt, that ability to be agile, it requires quick thinking, not no thinking and not just an automatic response. So it's really interesting listening today, not just reflecting on where we go in the next phase of this pandemic and the choices we have before us to make it fairer, to make it better and more effective, but what that actually says for the future. I don't know who said it first. There are different origins for the quote, but I think it's well accepted that every system delivers exactly what it's designed to deliver. So what are we delivering now? And in that sense, our global system, I don't mean global system as in surveillance system or technology system, our global civilization, both in terms of innovation, technology, data, trust, supplies, equity, healthcare. You know, I don't think anyone gets an A at any of these levels, and I think we really have to reflect. And not only if all of those sectors and all of those pillars are working well, in fact, it breaks down when they don't connect to each other. And we've seen that in some of the pre-pandemic hubris around how well prepared countries were. Yes, individual pillars within countries, individual systems were working well. But when they tried to talk to each other and act on behalf of people, they didn't do so well. And even when they did well at that, they didn't communicate that well to people, and it generates distrust. So not only the strength of individual pillars at all levels, but their integration and the level of trust that's generated between everybody. And it's not just trust from populations to governments. It's trust between science and the media, and trust between the media and populations. All levels of trust have been stretched and strained in this response. So I think, Joseph, it's really fantastic to have had this opportunity to reflect. I had the honor of being part of the previous roundtable discussion, being a participant. I enjoyed that immensely. I think I enjoyed today better because it was a chance to sort of sit and listen to some really smart, really, really incredible people bringing these different perspectives. And I think that's what we need more of. We need less people shouting at each other and telling each other who's right, and more reflection and time to think and time to calmly put. So much of this pandemic has been engendered in blame and accusation, even between scientists, and it becomes a very fraught experience. And it's almost like as parents we're taught, not to bring that conflict in front of our children. Well, in the same way, we've brought that conflict to our society and our communities. And as Akin was saying, communities interpret what's going on in a different way than what we think. And if scientists and politicians are knocking lumps of each other, nobody does well, because communities lose trust in everybody. So how are we going to make sure that the people we truly serve, our citizens, our people, our communities, are best served? And I think that goes for both the public and the private sector. So these kinds of reflections, this sort of ability for us just to speak about who matters. We've heard in this how much youth matter. I believe that absolutely. I'm not so proud of the planet we're handing over to our kids, either in the way the biome and the ecosystem and our political and other systems are being currently managed. And we need to step up as a generation to provide a better future for our kids and their kids. And this is the kind of conversation that gets us there. Not just the hardcore science and policy discussion, but this more reflective, engaged discussion that allows us all to speak our minds, speak our truths, and find better ways forward together. So this is, I think we need more of this, Joseph. I hope we can call on you all again. I think this is the beginning of a journey, of a process. And it's very, very healthy for WHO as a big multilateral organization as well, to be listening and hearing this dialogue. And it reflects the objectives of the EPI-WIN network and what we want to do in terms of broadening our listening, in terms of how we take our organization forward as a leadership organization, yes, but as one that listens and one that truly reflects the constituents and the stakeholders that we have around the world. So thank you. I don't know if Sylvie wants to make any comments from her side, but I've really been honored to listen to this. And as I said, I've had the most enjoyable 2 hours of the last number of months, having the opportunity to sit back and listen to such wonderful people.
Thank you very much, Mike. That's really appreciated, those closing remarks, and good to hear that you had a productive 2 hours and that it was also inspiring and insightful for you. Okay, so that leaves us to again thank you all, the audience, the panelists, and of course also the organizing team in the background who've worked incredibly hard with some last minute changes and final preparations to deliver this excellent webinar and panel discussion. So thank you to all the team from WHO and from Arab, and we wish you all a very productive rest of the day. You'll be hearing from us again, where we hope to continue the conversation over the coming weeks and months, and all the best. Thank you very much for listening in, and goodbye.